Good morning, everyone. Can you hear me? Great. So, a lot of people accepted this invitation, but I don't want to hold everybody up because, we all have busy, busy days. So I'm going to get started. Just first of all, want to remind everybody that we're recording this, and so I will be posting it to the blog by the end of tomorrow, if not earlier. Just thank you for everybody for taking time out of your schedules to come and join us in this meeting. I have a couple things to talk about, and then I'm going to turn it over to you guys. So the first thing that I want to talk about is we've recently seen a rise in tickets regarding the difference between the worker record and an MIS user account. Um, the worker record is created by a supervisor or a program manager, and it is located under settings. And I'm just going to share my screen. All right, so I'm using a test site, and so everything is fake that you're going to be seeing. I just want to make sure everybody can see the screen. Great. So the worker form is located under settings, and as I said, it is created by a user with supervisor permissions or with supervisor permissions, and usually that is a program manager or a supervisor. The MIS account is created by us, the MIS tech team, and we need a ticket sent to us with the staff person's name, an active work email address, and the role that they need to perform their job function. There are two videos on the blog, and that will help you with details regarding these two items. One is, well, I think there's two worker record videos. Yes. So there is exploring the worker record and then terminating and reinstating the worker record that will help everybody understand how the worker record works and things like that. And then there's the MIS login screen that, along with giving troubleshooting hints about, if you're having trouble logging in, it actually gives a full detailed rundown of how you submit a ticket for a new user account and the descriptions of the different roles that we have in the MIS. So I highly recommend taking a look at those. Now, while we're on the subject of the worker record and the MIS, I'm just trying to find my test site there. While we're on the subject of the worker form and the MIS user accounts, another question that we've had recently is about unlocking accounts. Anybody with a supervisor permission level within the MIS can unlock an account, and I just want you to see if one of your staff people's account has been locked out. You can go to the worker record form, and down here on the first tab, you'll see unlock account, and you can just click this, and it will unlock that user's account. Okay. Obviously, if it's after hours or your supervisor is not available or whatever, you can still send a ticket to us and we can unlock the account. But we're just showing you that anyone with a supervisor level of permission can unlock that account. The other thing that we've received tickets about is linking the account to the username. Obviously, you have to have the MIS account created by us, the tech team, before you can do this. But attaching the username is really, really, really important because it creates the worker dashboard on the homepage of the MIS. One thing that I want to make note of is that once a username is filled in this space, you can't see it any other place. So these are all of the available usernames that for this program, but because L Van Pelt is used, you won't see it any other place. Okay. Are there any questions about the stuff that I have discussed? Like I said, there are a few videos that you can watch if you want additional details on this information. The next thing I want to discuss is today is filtering reports. So this actually, the frequently asked question committee asked me to review this with everybody because of CWP cases, and there's only a few programs that are CWP ready, I guess. But eventually everybody's going to be CWP. So it's like they asked me to review this. Um, just an FYI, again, there are case filter videos on the blog. And there is one for creating case filters, and only a person with supervisor MIS permissions can do this. And then there's using case filters. And so I highly recommend you guys watch these, and you recommend them to your staff to watch. They're very helpful. And can't find it again. Okay. So just going to go through how to use a case filter in a report. Um, on the reports, if a case filter is available, it will say so right in the uh, report name. So I'm just going to run the active case list report, and I'm going to change my start dates because this is a test site, and we don't really have a lot of recent value data. So here are all the available, the active case filters, sorry, for this program. And I'm just going to go down here and I'm going to tick this box for CWP cases. And then I'm going to select a yes. Okay. And that should bring in, and I apologize if this is running a little slow. It is a test site. When the report finishes, all the CWP cases for this report timeframe will appear in the report when it eventually runs. And I, again, apologize. Please hurry. I guess I should play my, oh, here it comes. Hopefully. This only happens on the test site. It doesn't happen on the live site. So here we have 3 cases that meet our case filter criteria. And we can see right here, case filters used, CWP equals yes. And there are 3 cases that meet that criteria. So again, watch the videos on how to create the case filters, watch the videos how to use the case filters. These cases, actually, let me just go to one. You actually have to indicate on the case filter tab that this case filter is being used. Okay, and again, the using case filter videos will go through all of this. So I'm going to stop my share. And that's all I have. I know it was a lot. Again, we're recording this, so if you want to review it or share it with your team, it will be posted on the blog. But now it's all up to you guys. Do you guys have any questions, any issues that you want to talk about?
So you're saying that we have to manually indicate from the case that it was a CWP case? Is that new? Because I think there was some that I've had that are CWP that the filter was already kind of selected. Um,
Yeah, CWP is a special case filter. You'll see it as Child Welfare Protocol all spelled out. and that's a statewide one that is automatically populated when you enter the screen form. And it determines that based off of the type of referral source. So if it's number 16, which says DSS slash CWP, I think, or CWS, parentheses CWP, then that case filter will be yes. So child welfare protocol is the only case filter where it's automatic. All of the others have to be manually selected.
Okay, so you wouldn't necessarily need to make a separate CWP filter because it'll automatically be under that child welfare protocol written out filter. Okay.
Exactly.
Right. And I'm sorry for that confusion, but you would still have to select it in the report. So to filter out. Questions?
Hi, Corianne. I have a question, please. Melissa
Okay.
here,
Sure.
the Family Chautauqua. If a supervisor has to change the day of the week that she typically holds supervision from, let's say, a Friday to a Monday, I'm guessing that the first step would be to do that in the worker form. And then, are there any implications when it comes to reports that I should know when this change happens?
Yeah. So here's the thing, Melissa. So you can change your supervision day to any day of the week that you want, but because of reporting, we recommend that everybody is listed on the worker record having Monday as their day of supervision, because then you'll have 5 days in which to complete that supervision, and the reports will stay that if you change your day of supervision in the worker form, then your reports are going to show that certain people weren't meeting prior to you changing the date. So we recommend that you don't change the date, that you just do it on paper or in your calendar, but not on the worker record.
Okay,
We
thank you
recommend
for
that
that.
I'm sorry, we do recommend that new staff members, you just put them as for a Monday, and then just schedule your calendars for any other day of the week. It's just makes more sense as far as the reporting is concerned.
Sure. So because I didn't do that and I actually had the proper day for our staff in the worker form as the day that it was literally happening, if I change it to Monday now moving forward, is that a wise thing to do, or
I
is
think
that going to really
leave
throw
it.
us off?
I think you should just leave it because it just might mess with your reporting. But for new people, you should put it as a Monday. But on your calendar, you can switch anybody to any day that you want.
Okay, thank you.
Joe had a couple questions. Will there be any consideration of being able to create a worker who isn't an FRS? So to answer this question just generically, no. As far as I know, there was no plan to, because the worker record is really for people who are handling caseloads or managing and supervising staff. And the worker records are also tied into all the training reports. So for instance, if you have somebody who is not an FRS or a supervisor or a program manager and managing staff, then there wouldn't be any reason to have them have a worker form. The MIS account is certainly different. There are people who have MIS accounts that don't have a worker record. And your example, so I mean, would your host agency, would they be would they be actually like handling a caseload or completing supervisions or observations, Joe? Because that's really the only reason to have a worker record.
No, they wouldn't, Corey. We had this situation actually a couple of years ago as well when we had an intern. We had you guys create a worker record for that or a user account for that intern to be able to track the, like she would complete the screen. She would be the first one to contact the family to confirm they screen positive and stuff, and then she would enter that in there. But without a worker record, she was never able to record that under her name because there's no worker record. So it would be the same thing with our referrals coordinator at my host agency. If she receives a referral from the local hospital, so if she wanted to enter that referral into MIS and then document that she called the family to confirm that they are a positive screen or they actually wanted the services, she can't do that because she doesn't have any drop downs within the MIS if we created a user account but not a worker form.
So
Correct. I
think,
believe you're going to have to be a Healthy Families New York FRS or FSS worker. And if you're not, that would be something you'd have to discuss with, I don't know, OCFS or
Right.
with Healthy Families directly about having people putting in referral forms if they're not trained to be an FRS or an FSS.
yeah,
That's why we have all those training records and all that kind of stuff too that go on to make sure that no one's doing certain things if they're not trained to do them.
right.
So that would be something you need to bring up at a higher level than us.
Yeah, I mean, that would be actually probably, Joe, we'd have to create a new role and we couldn't, for the MIS people, that would have to come down from OCFS and CA if they wanted it, like if it was like system wide, if everybody, needs this or wants this, then it, like Chris said, it's a bigger conversation at a much higher level.
I think that conversation is worth having because I
Yeah,
was
I do
just kind
too.
of explaining that similar issue. And in terms of like the best practice standards and stuff, it's really just surrounding the direct work with families in the context of home visits and assessments, as opposed to kind of completing a screening. And so we might have, an initial engagement with a family that really isn't with somebody that is going to be responsible for doing assessments or home visiting, but they maybe explain the program, gauge some interest, and then it gets handed off to somebody. But we want to be able to track the that contact as being done by that person, as opposed to somebody else that is involved with the program in another role.
Yeah.
Yeah, so we'll bring that up with OCFS at some time in the future and discuss it. That's very complicated right now because of how their best practices work in terms of the training records. Like all workers are put into all the training reports. So if we had a worker, we'd have to make sure that special person's excluded. I mean, we can have that discussion. We will. It's just a lot of work. So don't hold
Yeah.
your breath on it right now. And it's going to be a lot of meetings to understand exactly how it works. What if this person wants to get moved up to an FRS at some higher level? Is there going to be a history kept? There's just a lot of questions. So yeah, we'll bring it up with them and we'll discuss it, but it probably could be something off to 2026.
Right. And you might want to bring it to the attention of your contract manager just to kind of get the conversation started. Because like Chris said, everything in the MIS pretty much is based on the best practice standards, and there is no standard regarding somebody outside the specified roles doing a screen. So, it's a big conversation. It's a lot of conversations, like Chris said, and it may or may not happen, but I get it.
So kind of along that same lines, what do you recommend as far as the program manager role? I have never entered my worker form as an FSS or an FRS because I don't do direct service work. But with that being said, if I enter a referral, I don't show up in the drop down either. Should I go ahead and put myself as an FRS so I show up in those drop downs, or
Are
Have
you
you had the
trained, Joe, as an
trainings?
FRS?
Yeah.
yeah,
Have you had the
everybody
core
has. All
training?
the program managers have.
Then
Program managers
just make
require-
yourself an FRS and you'll show up in those
Yeah.
lists.
Yeah.
As long as you're
Yeah,
trained,
that's-
that's the real key right there.
Yeah.
Yep. The most program managers should have all the roles, and they've also had all the trainings. And that just gives you the flexibility to fill in where necessary, or whatever, like you said, the situation. If you were just covering a referral, you won't be able to pick yourself. But all program managers should have all roles, because they should have had all of the core trainings.
Any other questions?
Less of a question, more of a comment, but I'm still kind of continuing to find it really difficult to monitor caseloads at the program level, especially when it comes to considering referrals that are assigned and the cases that are in pre-enrollment on the FRS tickler. Because we're not doing the assessment as a service in and of itself. The referrals that are coming in, we need to make sure we have the capacity to serve, and kind of have to go between the referrals list, the FRS ticklers, and the program caseload summary to really kind of get an overview of how many referrals a worker has compared to the actual active caseload and those that are kind of in the pipeline on the FRS tickler. So is there any amendments to the report or another report that will kind of have all of that information together?
There's not right now, but that brings up a good point. If one thing we always need with reports is kind of like that outline of what you're looking for. If you could mock something up in a Word
Oh, I got
document.
it.
Oh, yeah.
Because that's what I'm doing to kind of track right now. But
Yeah.
like, it'd be nice if it was all within.
Send that over to Corey, and either we can modify an existing report or we can create a new report that will kind of give you and everyone else who's looking for this kind of thing, that type of thing. That's a great idea.
It is a
Yeah.
great idea, and that's why these meetings are so awesome. Because
Yeah.
I bet
I-
you
you know, I-
helping
I
a
think
lot of
what-
people.
Yeah, what happened was we bolted the referral system onto the MIS, and not all the reports are necessarily sensitive to that. So I think it's a good idea to rethink how we measure the caseloads and take the referrals into account.
Yeah, I mean, Joe mentions that, would it be possible to add the referrals to the FRS tickler, and then we can see the referrals assigned to the tickler, assigned to
Yeah.
each FRS. So,
Yeah.
yeah. So Emily, as Chris said, just send your document over to me and we'll take a look at it. Thank you.
And maybe we'll share it with a few other people if you want to. Just raise your hand and we can send that around and see if there's anything else you want added to that report. Before we just do exactly what one person sent us. It'd be great if we get everyone's input on it.
Yeah.
No, you don't need to raise your hand. We'll include you anyway.
Anything else? This meeting has been really productive.
I had a question. In regards to, hold on, somehow my video is not turning on, but yeah, it was a question that was raised in one of my supervisions in regards to submission of paperwork, specifically the home visit logs. And I guess the FSS was wondering why was that, well, first of all, the paperwork was submitted late, right? So it was submitted after the 5th, which all of our FSSs are well aware that after the 5th, those home visit logs are not going to count for that previous month in the reports. But the paperwork was submitted, say, a couple days after the 5th. And then the FSS then reran the report, and I guess they were wondering why it was that their score was still the percentage hadn't moved at all. And the only explanation I could give was, well, these logs were submitted late. And so, but I didn't know if it was that like even if it was a couple of days after the 5th, if somehow like, it will pan out like within the next couple weeks or how that
Which
works.
which report was
Leanna,
it?
I'm sorry.
home,
It was the 4-2.
visit rate.
Yeah, the home visit rate report. Yeah.
Yeah, the date of the data entry is not really relevant. It's the date of the visit. And I was a little confused what you were talking about with the 5th. I mean, as far as we're concerned, we consider the 10th to be the cutoff, but right now we only do that 2 times a year when we do the performance indicators. We expect the data to be entered by the 10th of the month following the performance indicator period. But the key thing is that if you entered a home visit log today for September and then reran the report, you're going to see that log in September, and their rate should be adjusted automatically. If Leanna, if there's a specific situation where they entered some logs and didn't see them in home visit rate report, then that's something that you should bring up with us through tech support, because sometimes there could be an oddity with when their level changed or when the worker changed, or there's actually a lot of things that could happen that would affect the home visit rate report. But in general, like I said, the data entry date doesn't matter. It's the date of the visit that's important, and that's how the report decides which visits to include.
Okay. All right. Thank you for that clarification. Yeah. Maybe I'll
You're
submit
welcome.
it on that.
And also, Leanna, I just want to piggyback on what Jay said. If you think that there's a problem with the report or you want further clarification, please send a ticket.
Okay. I'll do that. Thank you.
Stacy has a question. Is there a way to implement where a supervisor reviews something and it needs updating correction that gets kicked back to the FRS so it doesn't sit on the supervisor, on the soup to approve, and then the FRS can resubmit once updated? No, generally this happens during supervision, so it's updated during supervision. That's my understanding of how it happens. This is not me telling everybody that it has to happen.
I'm going to quote Chris from earlier, and that would be a lot of work. We have actually kicked that idea around of sort of a feedback system related to form reviews, but it didn't really go very far. I wish we had better advice for that. But it is definitely sort of a sticking point. When the forms have to go back and forth, like there's really nothing in the system that can help with that. But it's definitely on our list, but it's so complicated and so difficult that it's a much lower priority at this point. But like anything else, if the roar gets loud enough, we're going to have to listen. So if everyone else feels strongly about that, then please let us know.
Or let your contract manager know and they'll bring it to a regional meeting or a CA meeting. Marty has a question. Is there a report or a way to see a list of what supervisions a particular family has discussed? I think, yes, there is. Let me just take a look. I'm sorry, Jay, you're muted.
Supervision cases discussed report. I think that's what she's asking about.
Yeah, I'm just
Thank
gonna,
you. I will check that out. Thank you so much.
You're welcome.
I have a question about the prenatal, postnatal, um, medical visits for PC1s that are now coming up on the QA report. So I noticed that I went in to put one in for a mom that had had the baby. I went to put it in, I did put it in, checked the QA. No, I'm sorry, I checked the QA report before, um, wait, I'm sorry. I think I'm confusing myself. So it came up on the QA report. We did the birth outcomes form. I went back to the QA report and it was gone. So well, I guess my question is it going to at some point stay on that QA report so that it reminds us we have to put that in at some point? Because right now it's coming off it once the birth outcomes goes in. Does that make
Well, that
sense?
sounds more like the tickler that you want, May, and not necessarily the QA report. The QA report, it was showing up in the infrequent entries for target child medical. Is that where it was
No,
showing up
it's
on the
for
QA?
it's for the prenatal and post prenatal visits for PC1.
Oh, for the mom's visits. Okay.
Yeah, that are now required.
Um, hmm. Yeah, that's the active prenatal cases with 0 prenatal
Yes. Yep.
medical care visits.
Yeah, and what
Yeah,
I
so once
noticed,
the child's born, I'm sorry,
yeah.
go ahead.
No, go ahead. Go.
I was just going to say, once the child is born, then they're off of this report.
Okay.
Whether that situation has been remedied or not.
Okay.
I'm 98% sure about that. Because you said once you entered the target child ID and information that they fell off of this report, correct?
Correct.
Yeah, I'm pretty sure that's because once the child has been entered, then it no longer meets the cohort for the case. I can
Okay.
quickly verify that by looking at the documentation.
Yeah, that's what I found that happened. But you just mentioned there's another report that I could pull up that shows what moms I still have to do that for.
Well, yeah, let me just finish what I was doing here for a sec. Because the tickler report lists all of the scheduled events. Now, as far as the prenatal care visits, I'm not 100% sure about that. I have to
Okay.
look at it, but
I mean, right now I'm keeping track kind of on the side on my own, but I wondered if there was something a go-to continually to look at.
Well,
Yeah.
for prenatal care visits, there's not a set schedule in the MIS.
correct.
So
No,
I
but
don't, go
but
ahead.
it's expecting us to do that. So,
It's expecting at least one per month.
Yeah.
There's no schedule per se, but one per month.
okay, so the expectation is one per month, not one.
I'm just speaking to how the QA report works. It says,
Okay.
yeah, it's only going to pick up prenatal cases where there's been 0 prenatal visits in the month.
Okay.
I believe there's a policy for New York on prenatal visits, but I'm not positive what it is. So you might want to check
Okay.
with your contract manager.
Yeah, this is pretty new, so I just wondered,
Yeah.
Looking forward, kind of tracking it and all of that.
Yeah, and it's possible that may come up, but as far as we know right now, there's no set schedule, and without a set schedule, the MIS can't prompt you to do anything. It can just tell you, okay, no visits have been done in this month, something's wrong.
Okay. All right.
Yeah.
Thank you.
That's certainly something to consider. We have to double check the standard and see what the exact schedule is. But So I was under the misunderstanding still that we were talking about the TC Medical, and that is um the whole schedule you can see on the family, excuse me, on the family timeline.
Yeah.
Um, and the ticklers include all of the scheduled TC Medical too. But like Ben said, since we don't have a built-in schedule for the prenatal care visits, they won't show up on any of those reports.
Okay.
But that's something to consider. And again, if more people feel strongly about that, they should let us or OCFS know, and that way we can gauge the importance of it.
I mean, the
Okay.
cohort on the QA report says cases that were rolled prenatally have been enrolled for at least 7 days as of the end of the month, have not been discharged, and do not have a target child identification and birth form entered. So that is the stopping point right there. It says it right in the cohort.
Yeah, sorry, I researched that, but then I didn't report my findings back. But that's what I found. Once the TCID has been entered, they drop off of that QA report. So the reminder is essentially gone there
Right.
once you've entered the TCID, as far as the system is concerned.
Can I say I have an example where the mom had her visit prior to her enrolling into our program. And so therefore they were asking for another visit, and that's not possible because she's so early in her pregnancy that now it wouldn't remove itself off of the QA report.
Sure, Liddy, do you want to give us that example?
Sure, I'll send it to you.
Okay. Yeah, we'll look at that. Like we said, it's easier to handle that through tickets where we don't have a bunch of people meeting, and it might take a few minutes to figure it out. So it's easier if you send a ticket.
Thank you.
I just want to, in regards to Marty's question about the supervisions for family discussions, Ben pointed out that there is a report called the Case Supervision Discussion History Report. So I just wanted to put that out there so everybody knows about that report as well. And Stacy has also offered, with the prenatal visits, our county has a maternal child health nursing program. So some of our families are getting home visits by the nurses. Is that something to add as an option? That is also
that goes back to the prior. Sorry, Corey, go ahead.
Well, I'm just saying that anything like that that's to be added, Stacy, we'd have to get permission from OCFS and CA. A lot of this stuff is out of our hands. As I said earlier, the MIS really is based on the best practice standards and the central administration guidelines. So anything like this that's going to be added has to be discussed with them, and then we have to talk about reporting and things like that.
Yeah, I think also Sullivan's kind of unique in that situation. Not a lot of the healthy family programs are run by health departments, so they may not have nurses available to do that. So it's sort of unusual even across the state. But again, that's something that either we'd have to add a certain class of worker to the worker record that does not have to get training, or we'd have to have a separate list of nurses that you could select, and either one would be a lot of work. And again, we'd need approval from OCFS.
Just an FYI, we're not shying away from things that are a lot of work. We're just saying like the things that require a lot of work are going to take a lot of time and discussion.
Speak for you. Oh yeah, I mean, you're completely correct, Corey.
Yeah, Stacy, again, to add to the drop down, to add the nurses to the drop down, it would still have to be considered by OCFS. Any other questions? We got another 15 minutes. I guess oh, go ahead.
I just had a clarifying question because I'm in MIS right now. I know that that it was mentioned, I think Jay had mentioned the one report of the, was it called Supervision Case Review Discuss Report, or did I mix that all up? So I know there's a case
You're
discussion
muted.
history. Oh,
There are two supervision there's two reports that list what cases were discussed during supervisions. And one of them is called the, as Ben said, the Case Supervision Discussion History.
okay.
And the other one is called just Supervision Cases Discussed Report.
Okay.
I think if you're looking for a more case-centric view, that the history report is better. Let me just take a quick look at that. Yeah. If you're looking for the history for a specific case, the history report is a better report to use for that, because you may have to jump around in the other report. And as long as the case was assigned to the same worker, you'll find all the supervisions listed where they were discussed in the supervision case, the case supervision discussion history report.
Case supervision history. Okay. All right. Thank you.
You're welcome.
And I'd recommend reading the documentation for those reports because they do only include cases that were discussed in depth, along with a couple other restrictions.
Yeah, that makes sense. Okay. Thank you.
Good point,
Yeah,
Ben.
good point. Thanks, Ben.
Yeah, because and along with any with all of the reports, most of our reports have report documentation, and it's just a good idea. Like if you have a question about report, just take a peek at that documentation because the cohorts are pretty clearly described there. I just want to mention that our next Healthy Families discussion meeting is scheduled in December. It's on a Tuesday this time, and it's December 17th at 11 a.m. And I will be sending an invite as the date gets closer.
Corey, and I'd like to add our new supervisor to be included in an email so she could participate in these discussions. Should I send you an email with her contact information so we could include her?
Yeah, just
Or
her
how-
email address actually is all I need.
Okay, great. Thank you.
And that goes for everybody. If you have people that you want added to this group, just send me email addresses and I'll add them to the listserv.
Which one is it, Corey? The all users?
I don't know. I have to take a peek at it.
Okay.
We have a new process now, though, so I think that more people are going to be included in our listserv. Every time there is a new account created by anybody in the group, I get an email with the email address and I just add it to the listserv. So thank you, Ben.
Yeah.
Okay. Unless anybody has anything else to discuss, I think I'll, say goodbye. Like I said, this is recorded, so we will be posting it by the end of the day tomorrow, if not earlier. And then once again, I just want to thank you guys for participating and coming to these meetings. I want to wish everybody a very, very, very happy holiday Thanksgiving.